Living with cancer shouldn't mean living with pain or other distressing symptoms. It shouldn't mean worrying about the fact that treatments may not meet your values and goals, and it shouldn't mean worrying about your family and your other caregivers. And what palliative care does is it provides that added layer of support to patients with cancer, both those who are going through active disease-directed treatment by helping managing side effects and helping to improve quality of life in that setting, helping survivors who may be living with treatment-related side effects and complications well after the disease is cured, and also helping persons who are living with cancer on a daily basis by focusing on improving their quality of life in the setting of that disease. There are three big gaps in palliative care research related to cancer and other serious illness. The first is around pain and symptom management. Whereas we have reasonable treatments for some pain syndromes, the vast majority of pain syndromes, we don't. And in fact, the drugs that we have, opioids, all have extensive side effects. When you look at other symptoms that are highly prevalent in cancer, loss of appetite, fatigue, breathlessness, we have very few treatments that are highly effective in improving the quality of life for those patients and families. So we need a huge amount of research around pain and other symptoms and around psychological symptoms and spirituality and addressing spiritual distress. The second area that we need enhanced research is around communication. There's this myth in medicine that doctors are born able to communicate. The reality is that these are skills that need to be researched, taught, and then promulgated. And the third area where we need tremendous research investment is to develop the new models of care that appropriately care for people with serious illness and meet their needs. Patients with cancer and other serious illness need more than just a physician's visit or a physician's office. They need somebody to call when there's a crisis. They need help at home. So we need to be able to develop these models that meet the patients wherever they are, rather than expecting patients and their families to always schlep in to see us in the doctor's office. This is a huge knowledge gap for us as a field because where there's a limited evidence base for palliative care in adults, the evidence base for children is almost non-existent. So, for example, we know very little about how to treat pain in the setting of active treatment for kids, even less about how to treat fatigue, less about how to care for the siblings of kids. For kids who survive their cancer and live with oftentimes the side effects of treatment, they often live with ongoing pain, particularly nerve pain. They live with fatigue. They live with other side effects. And as a field or as a medical field, we haven't directed the amount of resources and research to managing symptoms as compared to these directed treatments. I think there really is a sea change within the cancer community. More and more, we're recognizing that the focus of cancer care needs to be on the person and the family, not just specifically on the tumor and the disease. The focus is now really on the quality of life for people living with cancer and the quality of life of their families. And I think palliative care has a huge amount to offer in terms of improving the quality of life for people living with cancers.